It has been described as one of the world's worst humanitarian crises. As a result of the conflict in Darfur, more than 2 million people are thought to have been displaced, and as many as 300,000 people are estimated to have died from disease and malnutrition. The crisis has now spilled well beyond its borders, with more than 200,000 refugees living in the deserts of eastern Chad and thousands more in the forests of the Central African Republic. International Medical Corps is currently responding to the emergency needs of more than 1.25 million people in the region, but is faced with constant shortages of staff, medical supplies, and equipment.
Okay, this is a case of a 29-year-old female who fell and had a compound fracture of her tibia and fibula, as far as anyone could tell. The doctors had no x-ray machine here and pulled out any bone fragments, and it has been 2 months and there's no healing. We will be opening the wound and giving the patient general anesthesia under ketamine so that I can examine the bones and determine how much of a bone graft will be necessary. Also to show to the parents that some kind of treatment other than amputation should be available. If we'd had an x-ray earlier, none of this would be necessary.
Over the past 10 months, International Medical Corps teams have worked together with GE and the GE Foundation to deliver critical medical equipment to the region, along with longer-term efforts to train local health workers, mid-level health staff, and physicians. The equipment has now begun to arrive in Chad and the Central African Republic. Over the next few weeks, it will reach health clinics and hospitals for installation and professional training of local staff. These efforts not only address the immediate healthcare needs of these conflict and poverty-stricken communities, they are restoring critical health capacity and healthcare resources, which are building healthy futures for years to come.